Hi guys, it's Dr. Dawn, your OBGYN. I'm here on Facebook and I want to have a conversation about your own contraception. I see ladies all the time and contraception is something that we usually always talk about. So I'm here today to get candid about it, give you some tips on it, and hopefully you will get more information and gain your knowledge base by listening to this talk. So I'm going to start with my favorite contraception, which is the IUD. The IUD stands for intrauterine device. It is exactly that. It's a small T-shaped device. We place it in the office. It's placed through a small tube through your vagina into your cervix, and it sits inside your uterus. It has a small string that's attached to it, and with that string we trim it, and then it stays in place. And you don't think about it. So that's why that's one of my favorite contraceptions, because we women, we work all the time, we're doing things, we're taking care of the kids, we're taking care of our husbands or boyfriends or significant others. We need something that's going to be effective and do the job. And IUDs are very effective. You have a less than 1% chance of getting pregnant with that. And that is probably as good as you're going to get. The only thing that's more effective is going to be sterilization. So the IUD, it's out there. It's been out there for a while. You have two types of IUDs that are there. You have IUDs that have hormones in them, and you have IUDs that don't have hormones in them. If you do not have a hormone in it, it will last, you can keep it in place for 10 years, which is great. You don't have to leave it in for 10 years, but let's say, you have a baby, you want to space it out, leave it in for 3 years. Let's say you place it and you all decide you want to have kids. You can take it out after 3 weeks or 3 months. It's totally up to you. That's with the non-hormonal IUD. With the hormonal IUD, and the hormone that they have is progesterone, you leave that one in, depending on which one you have, 3 to 5 years. The benefit of the progesterone is if you suffer from heavy periods, a lot of heavy bleeding, the hormone will help you because it will decrease the amount of bleeding that you have. So depending on what my patient's symptoms are, I will use either the non-hormonal or the hormonal because they both work the same. It's just that one is going to give you the help with bleeding or heavy bleeding, and one really has no impact on that. Now, a lot of times people will say, well, how does the IUD work? I've heard different things. Dr. Dawn, what's going on? So the IUD, when it's in place, it sets up a spermicidal environment inside the uterus. So the sperm really can't survive, and it can't get to that lovely little egg that's coming down the fallopian tube and trying to get fertilized. So basically, it's spermicidal, and it sets that environment up. If you have the hormonal IUD as well, that hormone acts to thicken the cervical mucus that's right there. So it actually makes it harder for the sperm to even get into the uterus and make its way onto the egg. So that's basically how it works. So let's say you decide you want to do it. Nothing is perfect. So what are some of the side effects that we're going to see on the using the IUD? The main thing you're going to have is you can have a little more cramping with the non-hormonal IUD. That will definitely be in place, or can occur when we place it. You can have some cramping at placement, but also my ladies come in and sometimes they have a little more cramping with the menstrual cycles. That usually gets better after 3 to 6 months, sometimes sooner than that. Now, because the other IUDs, the hormonal IUDs, have progesterone in it, you can also get some of the side effects that you'll see with birth control pills. You can have breast tenderness, nausea, mild depression. Now, I'll tell you, usually you don't get any of that because the hormone really acts locally. So it acts inside the uterus. So the rest of the body, when we're saying the rest of the body, systemic effects, really shouldn't have that. Some ladies are so sensitive to any hormone in their body that they do get those effects. So some of the side effects you're going to have, like I said, breast tenderness, mild nausea, some ladies get depression, and some cramping, both of which will improve after you've been on it for a little bit. But the benefits, oh my goodness, you have long-term contraception. It's contraception you don't have to think about. and it just gives you freedom. It gives you options while you're using it. So that's the basic thing I wanted to talk to you about. I told you that it's a less than 1% chance of getting pregnant, so that's important because condoms are not going to do that. Even birth control pills are not going to do that. IUD is the same or the same efficacy as having a tubal ligation. So that's something to think about, because if you've had 2 or 3 kids and you don't know if you want to have children, but you know you don't want to have them in the next year or 2, that's the perfect thing for you to use. So hopefully you guys have learned something from this. I am going to have these candid conversations on contraception every Wednesday at noon. So I started with my IUD. I'm going to be talking about other forms of contraception, probably a birth control pill, because that's the one that most ladies at least start out with. But you definitely want to think about that IUD, because if I could put an IUD in my ladies every day, I would. I love it that much. I really do. So, all right, guys, thank you for joining me. It was a blast. I'll be back on Wednesday at noon. I'll probably be back on Friday at 4 p.m. It depends on what my schedule is like. Again, this is Dr. Dawn. I am your OBGYN, and tune in for more. Thank you.